Good morning, everyone.
Good morning.
Morning. Good morning. See some friendly faces that were on our WIC program yesterday. What a great day, right?
Super great. Great speakers and participants.
Thank you for not leaving me hanging there, Robbie.
And Jonathan, thanks for all your active participation. And Alyssa, I think I saw you were there too. So thanks to everyone for showing up.
It was a party.
It was so great. Like, we should all be so pleased that there was a 4-hour discussion with state leadership, WIC leadership across the state, across all geographies, thinking about how to better data share. Like, wow, we've made some progress in the last couple of years. Well, welcome everyone. Robbie, should we get started?
Good to go.
All right. Well, we've got a great lineup today. And I think there's just so much going on with policies and procedures. You'll all notice in your email while we are listening to our fantastic presentation today, make sure that you got the attachment, because we'll be talking about the letter that we need to rush out today to support some of the P&P discussion. We also have our state legislation, SB 313 from the Senate attending to talk about that piece of legislation. And Marilee and Jim, I see you're on too, will be giving us an update for carry quality. So we've got a lot going on, and I'll hand it over to Stephanie and Robbie to introduce our guest speakers from Benefit Data Trust.
Thanks, Timmy. Hi, everyone. I'm really excited that we have Alyssa Weiss and Janae Saffold from the Benefits Data Trust with us today. Robbie and I connected with the Benefits Data Trust when they released a playbook in January of this year called Data Sharing to Build Effective and Efficient Benefit Systems. They're a national organization and have a lot of really great insight, specifically work around WIC, which is highly relevant for us this week, and other public benefits programs. So Alyssa and Janae, thanks so much for being here.
Thank you so much for having us. Delighted to be here. I'm Alyssa Weiss, Director of Government Innovation, and I'm here with Janae. If you want to say hi, Janae.
Hello, good afternoon, everyone.
And we are 2 out of the 3 co-authors of the playbook, and just really delighted to be here with all of you. I will say we learned about you all and the data exchange framework in doing research for the playbook. We're just really, really impressed. We actually included it in our list of resources as just, something really exciting happening in this space. So it feels really great to be with all of you. Stephanie, are you going to move through the deck?
I can advance for you.
Awesome. Thank you so much. So today we'll just give you a little bit of background about BDT, who we are, what we do, why we're focused on data sharing. We'll talk about the playbook, some legal and operational considerations, and then do a little bit of a spotlight on WIC, because we know that's work that you all are thinking about fresh off of yesterday's summit. So with that, I think we can dive in. So BDT, who are we? We are a nearly 18-year-old national organization really focused on making the benefits access system better. We're rooted originally in Philadelphia. We're sort of en route to expanding, and then the pandemic happened, and that has certainly caused us to be pulling from amazing colleagues all over the country, which is really, really wonderful. Next slide, please. Thanks so much. So again, we are really focused on benefits. So particularly thinking about SNAP, Medicaid, WIC, energy assistance, Pell, so really focused on social safety net. And what we know is that these incredible benefits that are really there to support individuals and families in need are being left on the table. And there are so many reasons why that's the case. Folks don't know that they're eligible. There's stigma attached. They try to apply and have a lot of challenges applying. And so our focus is really on trying to change that and using a number of levers to address that. Next slide, please. So, we take kind of a multi-pronged strategy to address that. When we started, we were really focused on using data sharing and data matching, and that's, we'll talk about that in more detail, to identify people who are likely eligible for benefits and sending outreach to them, and then directing them to a contact center, to our contact center, where we help people apply for benefits over the phone. In some of our states, so we have contact centers in 7 states, and some of our states we're just helping folks with SNAP, and other states we're doing kind of multiple benefits over the phone, doing our best to kind of streamline what we know is a very challenging process, deduplicate questions, auto-populate data where possible, and just make up what we know is a challenging process easier for folks. We also do a lot of policy work. Janae is part of our growing and very mighty policy team that's thinking about working with, states and government agencies and, the federal government to think about, well, how do we streamline this system, not just providing direct service today, but really helping to make the system better tomorrow. So, and have been able to connect a lot of people to benefits, streamline the system for, millions of people, and are really, really just delighted to be here and talk about our work, particularly around data sharing today. So with that, I will turn it over to Janae, who will tell you all a little bit about kind of what this data sharing playbook is all about.
Thanks, Alyssa. Janae Saffold, policy attorney with BDT. Again, lovely to be here with you all this afternoon. So data sharing has really become a key part of answering one of BDT's key questions, which is, why are there people who are eligible for benefits but not receiving those benefits? And as an organization, we've used data sharing to identify and outreach to individuals who are on one benefit but not the other, even though they're likely eligible. For instance, outreaching to folks who are on Medicaid and we know they're eligible for SNAP, but they're not on SNAP. And we've executed 40 data sharing agreements across states and programs and sectors like higher education and healthcare. And throughout all of those data sharing processes, we received a lot of the same questions in helping states do this work. Is it legal? Is this secure? Am I allowed to even do this? And saw some of the same operational hurdles come up over and over. Data sharing processes that took over a year to implement, or challenges in merging data from one system and to another system that has a different format or different ways of interpreting that data. And so we really wanted to help answer some of those common questions for the field at large, envisioning, these aren't unique to any one state or any one agency. And so in January of this year, we released a playbook for states and local agencies called Data Sharing to Build Effective and Efficient Benefit Systems. And we spent the better part of a year creating this kind of how-to guide that gives those state and local administering agencies the tools to conduct data sharing initiatives in a way that complies with the law and hopefully helps them avoid some of the bumps and hurdles we've experienced along the way. We wrote it to support agencies at all stages of data sharing, whether a novice or an expert. We think it's got some helpful information in there. And it's informed by our experiences, but also interviews with government officials and experts, as well as a deep dive of existing literature on data sharing, like a white paper called Maximizing Linkages that actually looked at federal and California state law in the data sharing context. And we relied on that pretty heavily also. So if you haven't checked it out yet, we would encourage you to do so. We see this as a living document. So if any of this information doesn't reflect your experience, or you read it and think we got something not quite right, we definitely want to hear that information. Next slide, please. And I know this is a group that has a lot of data sharing interest and experience, but we might all engage with different types of data sharing. So just want to clearly define, what we mean when we say data sharing. And so the playbook is focused on data sharing for benefits analysis and outreach. And what we mean by this is sharing individual level data across benefit programs that have similar eligibility criteria. and then conducting a match to identify the individuals who are on one benefit but not on the other. And from that, you can then analyze the results to understand the size of any enrollment gaps and any demographic or geographic enrollment trends. But you can also use the results of the data match to send outreach to likely eligible individuals to raise awareness for benefit programs and share steps about how to apply or even how to maintain those programs they're already enrolled in. Next slide, please. And as we spend the time to talk about data sharing today, I thought it was first worth exploring why this is an effective strategy. Something we use a lot. Comparing benefit program lists is a really helpful tool in just understanding the scale of cross-enrollment gaps. We've worked with agencies that kind of just assumed that most people that were on Medicaid were also already on SNAP. But then when they actually did the match, they learned that they were missing tens of thousands of people in that enrollment gap. And similarly, we did a project with 4 states connecting Medicaid and SNAP recipients to WIC, and it showed the same thing, right? That the size of the enrollment gap was substantial. And when you go a step further and include demographic or geographic data in that analysis, you can really understand disparities in access and use that to build more equitable strategies and systems. Next slide, please. And as I stated before, you can also use the information to conduct data-driven outreach to those who are on one benefit but not the other. And the research here has also shown that it's an effective strategy in prompting action, increasing participation, and helping address churn. It's also efficient to focus on individuals who have already been deemed eligible for other means tested benefits because they are highly likely eligible for additional programs. And it's certainly more efficient for clients to be connected to a holistic set of services that address more of their needs. Next slide, please. And so our research has showed that agencies across the country, regardless of size, in red and blue states, are engaging in data sharing efforts. But we know that there are many legal questions about data sharing that can slow down or even prevent these efforts from happening. And that in turn keeps this strategy from being as widely adopted as it could be. And so to that end, we created an entire section in the playbook called Legal Considerations for Data Sharing. And this quote really captures the essence of why we included a legal section in a resource that's geared towards programmatic staff for data sharing and not necessarily towards attorneys. And really, it's just that it's helpful for parties to have a shared understanding of the legal landscape when you start this kind of a project. Because attorneys, as they are doing the research to give the program staff answers on whether the law permits what they're trying to do, and even when they go on to actually craft the data sharing agreement, those attorneys will rely on the program staff to understand the details of the project so that they can make those legal determinations. And so this legal consideration section was designed to aid those groups in working together, so that if program staff know these are the kinds of questions I can expect and the kinds of information legal teams need to know, our hope is that it can make the process a little bit smoother. Next slide, please. Legal teams will need to understand the purpose and the structure of the project because the permissibility for sharing data across benefit programs varies depending on the intended purpose and the structure. And so the playbook provides some foundational information on the importance of those questions that need to be answered in order to get to an answer on whether the law permits what you're trying to do. And you can see those legal questions here: who is sharing the data, who's using the data, what is the type of data being shared, and what is the purpose for which the data are being shared. Next slide, please. And then this slide lists the areas of law that agency attorneys may need to consult to give an answer on the permissibility of the data sharing project. The playbook at a high level covers some of the common overarching privacy laws like HIPAA, for instance, but then goes into depth with the legal analysis for sharing program participant data for 5 federal benefit programs that have overlapping eligibility requirements, and those are SNAP, Medicaid, WIC, LIHEAP, and unemployment compensation. The playbook also provides an overview of compliance with the Telephone Consumer Protection Act, which is a body of law that generally governs text message communications, like what kind of messaging is permitted, what technology you can use, and when prior consent is required. And lastly, an agency attorney might need to consult state-specific laws where applicable. We don't delve into that, just make mention that that is something that might be applicable to your project. As you can imagine, a document that includes an analysis of every state's data sharing laws would probably be pretty lengthy. Next slide, please. And the playbook focuses on situations where federal law permits data to be shared without individual consent. However, we wanted to touch on the idea of ethical consent, meaning although legally you're not required to obtain consent, is should you still obtain that consent? And we know that there are conversations happening about ethical consent centered around the idea that people should have a say in how and if their data is being used. And so we just wanted to call out that these conversations are happening, and that if states and local governments aren't already doing this, they should be thinking about this as they're considering using data sharing for analysis and outreach. We definitely are not the experts in this conversation and don't have all the answers, but just felt it necessary to call out that these conversations are happening and point agencies to organizations and resources to aid in having these conversations internally and importantly with their communities. And next slide, please. Lastly, the playbook goes over some common components of data sharing agreements, again, to build that familiarity with the program staff. Also touches on some data privacy and security components that need to be considered and implemented into the data sharing agreement. And then related to that legal consideration section, in the appendix, we have 2 data sharing agreement shells that provide the bones of a data sharing agreement that an agency could use as a starting point for crafting their own data sharing agreement for their own project and needs. And then there are 4 data sharing agreement examples that are agreements that have actually been used in the past for data sharing for outreach that have been redacted or modified. And with that, I will turn it back over to Alyssa.
Thanks, Janae. I just wanted to add, as part of that conversation about ethical consent, we pointed to some resources from Institute of Change, or Stewards of Change rather, and it seemed, I joined this conversation last week, and it seemed like some of you all are partnering with them on some additional like e-consent, which is really exciting and I think connects very much to what Janae was talking about. So next slide, please. So as folks who are pretty steeped in data sharing, I don't have to tell you that data sharing can be very challenging. It can be long, it can be drawn out. There are fits and starts. You can start and then stop for 12 months while a new, set of legal eyes takes a look. So we have a lot of experience with that and thought like there are things that we and our, the folks we interviewed know can help. And let's try to document some of those tips. So I'll just share a few of our top ones, and there are certainly more in the playbook itself. But first is really connecting early and often with your key teams, which we found to be those, program and operations, legal and privacy and data. We see that as sort of like the key trio, and making sure that, all those teams and the key representatives from both programs, or as many programs as you're working for, are sort of all on the same page the whole way through is really critical in sort of building a shared sense of what you're trying to achieve, and then helping make sure that the actual data share agreement, the legal process, moves forward as smoothly as possible. What we heard over and over again was, you can really do this work with just an Excel spreadsheet. You don't need the fanciest technology, the cleanest data, but you absolutely need trust and communication and buy-in and patience. So that's our first tip. Next slide, please. The second is to decide the data fields that you need to run and evaluate your initiative ahead of time in the process of planning the data sharing agreement, data DSA. Because if you are, for example, doing a text outreach process and you kind of get to the end of the data share agreement and suddenly say, oh, well, we need everyone's cell phone number, but you haven't included that in the DSA, that's sort of an immediate pause between, finishing that agreement and starting that implementation process. And so we really suggest spending the time to think through some of that implementation. How are you going to pull the data, use the data, and then evaluate success so that your DSA speaks to the fields that you need. Next slide, please. This is related, but really just cannot understate this, the importance of including demographic and geographic data in your data sharing agreement, because when you are able to include these fields, you are able to really understand the populations that you're serving and build solutions that are going to work for them. And you'll be able to evaluate that initiative and see who it's working for and who it's not working for. So for example, if you're pulling demographic data or if you're pulling data including preferred language, that can really shape the kind of outreach that you're sending. Because if you're sending outreach, to folks who are only speaking Spanish, but you're only sending it in English, they're probably not really going to respond, right, to your intervention. And so, using that data to inform the approach and then again to measure success and say like, wow, this whole population is really not responding. Let's see how we can reshape our initiative and make it stronger and really speak to those communities. We think is just a really invaluable place and way to build more equitable systems. Next slide, please. Tip 4, this is like really in the weeds, just cannot say, and like it's hard to pull these data together. It is hard because these systems, these programs are siloed. These programs have different policies. The data often live in different systems that were really not designed to speak to each other. And so sometimes the way, data is formatted is different. And so when you're trying to kind of share that data, match that data, and use that data, it's really hard unless you put in the time to just get, like, again, really in the weeds about how you're defining things like birth date. Are you and your sister agency defining it in the same way? And, putting in that time up front through, using things like data dictionaries. And, it's really worth that investment. And we also really recommend doing some QCing those first, matches to make sure like, oh, are we actually matching these files correctly and deduplicating appropriately, and that's really worth the time. Next slide. This is one that I think California really knows and understands, which is just don't start from scratch. We know this work takes a lot of time, and once you have something to build on, just moving from the implementation to sustaining and scaling through things like governance or statewide legislation or just ongoing committees is just really valuable. It's valuable not only to reduce the amount of time for each initiative, that it takes, but it's also, I think, really valuable to build trust across communities, across, folks who are working in government or in places where their job is to protect, private information. And so kind of building trust and being transparent about what are we doing this with this data? Why are we doing this with this data? What will residents gain out of our use of this data? I think is just a really important thing. And then again, I think as these initiatives are sort of built and you move them into kind of general operations, it really just makes the whole thing a lot easier. And we've kind of seen that in our own work, and we've seen that from other states when they kind of just absorb the work into their regular flow. Next slide. And just, there's so much potential from working outside of government, which again, I think all of you know very well, but, working with healthcare, working with higher ed, working with research, there's just a lot of power and potential to think about. For example, every Medicaid entity sending outreach about WIC or about SNAP to their members. And so there's just so much potential that we see and are involved in. And we have some tips in the playbook about that and sort of the power of these other sectors in engaging in data sharing around benefits access. Next slide. Thanks. So I know all of you had this summit, which is just really exciting. It was exciting to hear about it. So wanted to just take some time spend some time on WIC. So as Janae mentioned, we went into an analysis, a legal analysis of those 5 key benefits, and WIC is one of them. And what we've seen is that, WIC data from a legal perspective is really kind of tightly guarded. As you can see up here, it can only be shared with persons directly connected with the administration of the WIC program who need to know that information for WIC program purposes. And so when you're thinking about data sharing, it makes it much harder for WIC to share WIC data outside of the confines of its own agency or its own program. But that does not mean that you cannot do data sharing programs that are used to increase access to WIC. And what we've seen is that states use data from other benefits really as that basis of WIC outreach. And so you can think about, SNAP or Medicaid or, foster care. We've seen this in a number of states. TANF sharing their data about individuals who are on their programs with the WIC agency, and then WIC sort of running that analysis to see like, oh, who's on these programs and not WIC. And then they send outreach. And so, again, a lot of times these projects, people think like, oh, we can't do it because WIC, we can't share WIC data. And so we've seen it be very effective, again, to have that one-way data sharing into WIC, which does mean that WIC often winds up doing a lot of the heavy lifting of the kind of matching and analysis, but that way you can still do these projects. We have a lot of experience with WIC outreach in partnership with CBPP, Center for Budget and Policy Priorities. We started in 2018 and 19 to do pilots with 4 states, really just to test, like, this is a strategy that we've used, between Medicaid and SNAP. Can we use it with WIC? We all know this is an incredible critical program and it's chronically under enrolled. Like, is this a strategy we can use to really increase participation and enrollment in WIC? And so we saw really exciting, interesting results, made us want to keep doing more of this. We've done, in addition to kind of us doing the texting and outreach on behalf of states, we also ran a series of workshops with 7 states to provide them with TA to sort of support them through the process of doing their own kind of outreach themselves, published a toolkit to sort of make these key steps kind of available to anyone who's interested in doing this work. And this work and the results really informed USDA. Some of you, I'm not sure if you got into this yesterday, but the WIC 390 Modernization Fund, which is really thinking about a number of ways to increase access, improve the experience around WIC. And they're thinking a lot about outreach, and there's kind of a proposed investment around data matching and outreach to increase enrollment. The playbook itself kind of goes into this in a number of different ways. There's that legal analysis we talked about. There are case studies around WIC. Janae mentioned we have a couple kind of redacted templates, and WIC is one of those. So you can kind of take a look and see. So I'm going to stop there. Actually, sorry, next slide. Yeah, just to say, we want to hear from you now, after, later. So just really excited to hear from folks. I know, again, that the data sharing work we're talking about, I'm sure has overlaps, I'm sure has differences from the work that you're doing here in California. Some of this may ring true for you. Some of it you may be like, this does not ring true at all, and I think you should change things. And we want to engage in that and hear from you. So I will stop there and happy to talk through really any questions.
This is Robbie. Thank you so much to both of you for your time today and all this great work. And I do have a question related to WIC, as it's super fresh on my mind. And having kind of reviewed the confidentiality regs that I think, to those of us who are really familiar with HIPAA are, it's very different, right? And a lot of the confidentiality regs focus on the purpose for which you're sharing data. And, there are more requirements that as we're kind of building out our state single data sharing agreement, I think we will need to be kind of fine-tuned to the current regs that WIC programs are subject to, and how, kind of getting creative in terms of how can we bring WIC in, and obviously, a way that, meets their legal requirements. I'm curious if there are there particular tips or tricks you have to us as we might be able to draw on, your templates or your shells, thinking about, rules of the road that apply to everyone, where we might start thinking about, bringing WIC in to the DSA, and then obviously, accounting for those instances where there may need to be a separate agreement between two entities because, the USDA regs require it under law.
Mhm. I'm thinking, yeah, Janae, you go first. I have some thoughts, but I'd like Janae to go first.
Yeah, I was just gonna say from a practical perspective, when you're looking at crafting your DSA, I think there are ways to bring if the structure is the same, right, that you are sharing this WIC data that looks the same as the ways in which you're sharing this other data, it can be brought in. It's just a matter of making sure you're bringing those components under the law that are required into that agreement. And then I think it's fine to have it all in one. You just may have to have a few provisions or clauses that, only apply to WIC. But you can do that and bring WIC under that same DSA umbrella.
Yeah, I just, the current one that we have is that it needs to be mindful of all applicable laws. So I would think that WIC could potentially sign on to the DSA and just say that, I can't do X, Y, or Z because of law.
And
Yeah.
I also
Don't
want
let me make it that easy.
Well, I wonder too if there's potential to help. I mean, I don't, this seems like a big lift, but I'm just trying to think out of the box, helping create templates for state agencies. Should they want to work with WIC and share data, so that we,
It's done. Yeah.
sort of work like that so that we can make this exercise, useful for all stakeholders and not, while we do
Great
have
idea.
exceptions for applicable law, help.
What is that? Yeah.
Exactly.
Or have its own policy and procedure,
Mhm.
like have a PMP dedicated to WIC.
I just put into the channel something that was in the playbook about a child health information system in Rhode Island, where folks can look up various, healthcare status and includes WIC participation status. And that sounds similar to kind of the nature of what the California work is all about. And it might just be interesting to understand, because it seems like WIC could use others' information, right, to understand things. But the question is, can others see WIC status and so, or lack thereof? And so if they have been able to do it, I don't know if that's public, I don't know how that works, but that just could be an interesting example to see what legal systems supported that. And so that just might be one resource to track down.
Mary Sarah, I see a question.
Yeah, just even there's ways though, without disclosing the data, to be able to share the action that needs to be taken. So we always think about, you need to share the data so that the person can determine what action, but you could just tell the person the action that they need to take, like speak to your customer about applying for WIC. You don't have to share any more than that, right? And then you're not running into the same issues. So if you think about it from that perspective, what is the guidance that the data would have you give based on this person's role?
Right.
We've also seen some agencies start to use APIs. And so what's being shared is not the data, it's a yes, no. Right. It's like, that's what's and so I think that's similar to what you're saying of no data is being shared. They have the data, you have the query, and that what comes back is just kind of yes, no about eligibility or about enrollment or participation. And so that might be, there are just some ways I think we're seeing growing sophistication about how to get the information or the answers without actually sharing data.
And I think what's missed in this conversation often when we talk about WIC is the need for clinical data to be able to not only enroll, but continue to be enrolled. And that's a huge lift. So where and how we can also get that provider data into WIC electronically, it kind of gets all kind of caught up in this, and it should be really easy. We should make that extremely easy. Yeah, Katie, that's what I'm thinking. Robbie and Stephanie, I think we need to move on, but this is incredible work and incredible partners, Alyssa and Janae. I think if we could continue to keep this conversation up. And I love the fact that you are also welcoming our input. But as our DSA evolves, I think we can keep you kind of close to what that work is. And if you would also keep us what you're finding of innovation out there, we'd love to have them come and address this too.
Yeah, thank you so much. And please feel free to reach out to us with if this sparks additional questions for you. And we appreciate everything you're doing. It's really cool and inspiring. And thanks for letting us chat with you all.
Yeah, thank you. Excellent. Well, I think we are having some difficulties getting our next guest speaker on, Brian from Senator Dodd's. He is here, so we'll give him the floor just for a moment. Hi, Brian, welcome. Brian, can you hear us okay? All right, well, while we work to get him on, we'll just move forward really quickly. We wanted to bump this up in our agenda just really quickly, given that the CDII meeting was yesterday around the Implementation Advisory Committee and policies and procedures. I think in summary, there were a lot of proposed amendments or clarifications that CDII put forward in responding to stakeholder comments on the latest PMPs that were put out for the data sharing agreement. They are not yet finalized, and the meeting materials should be publicly available soon. The key one we wanted to highlight that was discussed for much of yesterday's meeting was around ADT notifications and, the proposal around sharing ADTs with AQHIO, other comments that were submitted around thinking of, that or another route to solving ADT needs, such as creating hubs or clearinghouses. And CDII, yesterday proposed that they just scrap an ADT notification requirement and instead, outline how hospitals could share ADTs with other data sharing participants, but in a more, I guess you'd say, passive way. So we would, we just this morning got an advocacy letter seeking sign-ons to request that CDII reconsider the requirement to share ADTs and work with stakeholders to find a solution. Felix, did you want to maybe provide a little bit more color around the letter and the timing and any brief thoughts on yesterday's meeting as well?
Well, before we go to Felix, I just want to make sure that everybody sees it in their inbox. So please take a look at your inbox. It came from Connecting for Better Health this morning. It's the last one you received, and it's a Word document. And APG is asking, you'll see right now, by 4:30 for additional signatures with logos. So I just want to make sure that you hear that, and we can come back to that as well with that ask. And Felix, if you want to walk us through the letter, that'd be great.
Yeah, thank you, Timmy. And about that 4:30 deadline, I wish it weren't so. We are basically racing against the clock because CDII is giving stakeholders broadly until 5 p.m. this evening to send what they're calling final comments on the PMPs, on the draft PMPs that are out for to be finalized. And yes, as Robbie laid out very well, we think that the pivotal one, certainly that has the farthest reaching implications, is what will happen with regards to the expectation for ADPs. Let's sort of walk back for a couple steps. It's obviously a very, very big deal that CDII has come out to first put forth even a requirement for hospitals to proactively send these notifications. There was a time not too long ago when that was still a question. So we are certainly glad that the answer is that hospitals will be required to send ADPs in one form or another. Now, the issue is that that form of how those messages get sent actually is also very relevant to the likelihood of them being received by the right care teams. Obviously today, a lot of providers, especially the ones that are integrated and affiliated with hospital systems, maybe on the same EHR platforms, have a much easier time getting these ADTs when they need them, when they request them on a regular basis. There are, in contrast, a large swath of providers in the community, particularly the ones in the safety net. I think a lot of the groups that are represented on this coalition, community health centers, small practices and PAs that really focus on caring for the Medi-Cal population and helping the state implement CalAIM. Those are the ones that actually are at the other end of this digital divide, so to speak. They aren't affiliated with major hospital systems. They don't get a plug and play ADT feed. And a lot of times, their members, especially if you're talking about enhanced care management recipients, are having hospitalization events, a couple counties over. So they have no way of knowing without, directly connecting to that hospital when and how to respond. So what we think is really key to solving this is, as Robbie teed up, some type of solution where ADTs flow through a connector, at least one node of a connection system, where no matter which direct connections a hospital may or may not have, that intermediary can sort, match, attribute, and forward the ADT to the right recipient that has requested it. The idea is to have it sent on a person-centered basis, not depending on whatever arrangement the hospital may or may not have with an individual practice or care team. That is the thrust of what we are asking CDAI to consider. They took one step forward, one step back, and we want them to basically, I think, rediscover the courage of their convictions and promote the right policy in this final PNP. So we definitely, we humbly ask for your consideration of lending your organization's willingness to sign on to this letter. You can read through it quickly, hopefully. It does try to get a little bit in the details to kind of respond to some of the arguments that some other stakeholders have offered against having this requirement. And we think really weighing the trade-offs, on net, it really is important that the state move forward with this proactive requirement for hospitals to send ADPs to at least one qualified HIO. How's that, Robbie?
Felix, in terms of kind of next steps, because I know we're on a tight timeline, can folks send, if they're interested in signing on, send their org name and logo to you directly? Does that work?
Yes,
okay.
Yes, absolutely, 100%.
Excellent. And I think too, I just put our comments in the chat. We would like to similarly offer the coalition's name as well, since we, similarly echoed the need for a ADT solution in our comments as well. And should we help get the word out? Sure, Marilee, please do. Send them on to Felix. So Felix, thank you so much for sharing this letter with us.
And I share the disappointment across the board that it is a building block. Every HIE, statewide HIE initiative pretty much across the country started with ADTs and required the ADTs to be part of, and in fact, I just met with Hawaii this week and they're kind of rolling their eyes about ADTs. Like, yeah, we got ADTs. Now, like, let's get on to what's next. So we've got to get this right, and the fact that they're kind of stepping back it's really, and that one, you'll see this in the letter, that one of the reasons that they are stepping back is because they receive more input to remove it than to keep it. Just means that we need to that's a huge call to action for this group. So yes, do whatever you can, get the word out, think about your partners that you work with on a day-to-day basis, that this is so meaningful. We will also, with Connecting for Better Health, offer our logo as well. But let's see what we can do. If anybody else has any ideas, please let us know.
Awesome. Thank you, Felix. Feel free to drop any questions in the chat too, if folks have them. I think briefly, and Brian, thank you for joining us. I know you are on a tight timeline, but we really appreciate you joining us here to give, I think, just a brief little overview, if you could, to SB 313 and maybe to what are next steps for stakeholder involvement in terms of providing any input on the bill as well.
Yeah, definitely. Thanks for having me, and sorry for the technological. I'm working on this artificial intelligence stuff because my intelligence cannot figure out the computer, so I need something else to do it for me. So we've got SB 313, which would establish the Office of Artificial Intelligence. Right now, it's kind of a broader idea in response to everything that we're seeing happen with AI right now. I'm sure everybody has seen it's pretty much the headlines for everything. So right now, the bill is pretty vague, and it would establish an Office of AI without any real clear direction what it would do. This was just to get ahead of AI back in January, and now that things are really starting to pick up, I think things are going to happen faster. The bill, as far as where it's at right now, is currently in the Senate Governmental Organization Committee, which I work for, and Chairman Dodd is the chair of course. And so we're going to, I think, hear the bill on the 11th of April. I think the idea we have for the bill right now is to require that if the state, and this is probably outside of where your interests are, but the next step we're going to do, I think, is require the state, if it's going to be using any kind of generative artificial intelligence, creating new stuff and interacting with constituents, we'd like the government artificial intelligence that is interacting with you to make it like clear on the front that it's a robot or an AI. So we're calling it the AI Aware, the iWare Act. And so that will be within the Office of AI. And so this is just kind of, as we're moving and we're all kind of experiencing the birth of this AI together at the same time, we're going to be constantly changing and adapting as, conditions change. I saw that some kind of medical application of GPT-4 was announced yesterday. So AI is definitely coming quickly. I think the health industry, education, and transportation is probably where AI can make the quickest and the most transformational change. And so I think we're just trying to be aware and be able to adapt as things change and get feedback from the people that are going to be on the front lines interacting with all these new technologies and changing the way that we view pretty much everything, honestly. Mm-hmm. That's kind of the quick spiel on that. I do have to run to go see the chair right now, but that's where we are with SB 313.
Brian, are you receiving pretty widespread support, or what?
I think we have like one official registered support. I think people aren't really sure what to make of AI yet. And since the Office of AI, as the bill is written, is kind of a broad, we don't really know what it's going to be. But I think the more details we put in with this awareness fact and the deadline for amendments to introduce new bills for the year, was it yesterday? So there's a whole bunch of new AI stuff that came online yesterday. So that we're going to just kind of keep going, I think. And so people are going to start paying more attention.
Excellent. Well, I think we'd love to follow up with you, Brian. We'll have more conversations here about the bill. And I think too, we're tracking Assemblymember Bauer Cahan's bill on the subject too. So I think what we can do as a next step is, touch base, I think, as a coalition with our folks here and kind of figure out what's a stance, what are some recommendations or a position we might take as well.
And then also like feedback, because we're trying to navigate the rollout of AI and figure out how this is going to go as smoothly as possible. So definitely, I think the other main point of the bill was to get people to start thinking about this. And I think that's really so far it's been working, and we're having these discussions. And so I think it's a good start. Excellent.
Excellent. Well, thank you so much for joining us and for leadership on the issue and bringing it out into the legislature as well and to stakeholders for. Yeah, definitely. Well, thank you. I look forward, we can touch bases again, and I'm sure there's going to be a lot more developments coming on this AI stuff. Definitely. Thank you. We'll be in touch. Ryan.
All right, sounds good. Thank you.
Thank you.
Excellent. And I think what we can do next with everyone here is we'll put together some thoughts and circulate some ideas for comment, and may have another ad hoc meeting on AI. But I want to make sure, Marilee, we get to care quality updates and hand the floor to you as well in terms of updates from the advisory council meeting.
Yes, thank you very much. Although I feel like I just need to go advocate on this ADT thing. So I'll
You
talk-
do.
Yeah, it's a definite action for all of us.
Quick check. I have a partner on the committee here, and he's traveling today. Jim, are you on the line? Okay, if not, no, for sure, but just so you know, there is more than one of us here participating, and we'll be divvying this up as we move forward in time. But to get started here, a little bit of this is repetitive from my last update, because we're so focused on this big initiative to update the care quality framework policies version 2. I think this is the most important care quality framework update since we started, because if you look at the details, it's really about trying to drive adoption beyond just treatment for data exchange. Things that I think are important to a lot of us. So for example, the mandating response to patient requests, patient access, mandating response to care coordination, two just critical purposes of use for data exchange that the community hasn't adopted. So what these framework changes do is to try to create terms and conditions by which we can mandate exchange for these reasons, but do so in a way that addresses a lot of the concerns that people had communicated to the advisory council and the rest of the care quality community. So these documents were just published. That officially, I think it was in the last week or two, started our official 60-day clock. In addition to the new use case and these updates to accelerate adoption, we also have some new audit log requirements. Again, these are to deal with some of the concerns for people who are maybe reluctant to share data. And that's really the crux of these changes. We can go ahead. As part of that, for those of you who are associated with the care quality implementer, all of us have survey responses to take care of. It's basically a readiness survey, which asks, are you ready to implement care coordination? Are you ready to meet the new patient matching requirements? Because there's some timeline requirements that need to be associated with this move to the version 2 framework. So be sure to plug into that survey if that applies to you. We can move on. In terms of our timeline, we're in the review phase right now, where implementers need to do those surveys, review the red lines, and get proposed edits or feedback back to care quality. Then the care quality staff will go to the language adjustment phase, where they will look at any final changes in the red lines they need to make. Then starting day 30 through 60 will be in a voting phase. So in the last framework adoption, we tried to create a model where we could move faster when we wanted to make these changes. So the nice thing is some of these changes could be out in less than 60 days, basically, which is exciting. I won't go into this. I talked about this last time. This is just we'll make these slides available to anyone if you want to go into more detail. This is the new on the behalf of use case. We can move on. The new patient request, there's a lot of technical requirements to mandate patient requests. So for those of you who are again interested in the details, be sure to get a copy of the framework, the proposed framework document. And there's a new kind of implementation guide that's quite detailed into how we're going, and it's really around validating patient identity and how we're going to share technically those tokens of, yes, I validated this patient's identity with the correct, in compliance with the requirements, and that will get more, again, it's all about adoption. Also, there's a big alignment with TUFCA when it comes to this patient request implementation guide, which I think is very exciting. You know, if you can comply to the care quality patient request implementation guide, you're going to be ready for TUFCA and QHIN. And then the other one that has a lot of details associated with it is the mandated sharing of data for care coordination purposes under certain terms and conditions, and also putting some requirements on those folks like payers or payer contractors who are, you know, have to validate that they're doing this query just for care coordination purposes. That's part of the framework requirements. But they also have a duty to respond to the extent that they're able to do so. And we can keep going. For those of you who will be at HIMSS, obviously Care Equality will be there. They're going to be focused on the interoperability showcase on the 360X care transitions data exchange use cases. I'm excited to see that one because that's actually an area I don't know a lot about. So I'm looking forward to learning that, and we can move on.
That came up yesterday in the WIC seminar.
Oh, great.
That there is a gentleman who is working on that standard with Epic.
Mm-hmm.
So it's definitely something we should be looking at. Thank you.
Yeah, I think it's an area that has been talked about that we need to, more of us need to know and understand it. So yeah, I'm excited about that. And then there's a number of other meetings where folks that are, you know, in the very involved in care equality are participating in, and you know, these are a lot of the interoperability meetings that will be going on there at HIMSS, and a lot of information and presentations around the status of TEFCA, and from, you know, hearing from the RCE and from the QHIN applicants themselves, which will be very interesting. And I think that may be it. And Jim, just in case you're on, do you have anything else to add? I don't hear him, but if you do have any questions on the details, don't hesitate to reach out to either Jim or myself or both of us. We're always happy to hop on a kind of one-on-one call and just walk you through any questions that you might have.
I've got a question, Marilee. Thank you so much for this summary, and I think it's super helpful as the DXF moves along, as well as TEFCA. I'm curious what conversations might be percolating around, I don't know, V3, or, you know, kind of moving into other like payment or operations use cases, especially in light of TEFCA or even say the data exchange framework. Has there been any conversation of, you know, care coordination and then other use cases too?
Yeah, that's partly why you're seeing this new language around care coordination specifically. I think there's a whole work group around healthcare payment and operations, right? So that this whole area that we've not had a lot of success with. And part of the outcome of that group's work was this new mandated care coordination, very specific data exchange to at least get things started. And I am not as familiar with the work of that group, but I know there is a lot of conversation to take the next step. And of course, with Care Equality being the technical advisor for TEFCA, you know, that alignment is kind of helping move things forward. Mm-hmm. I think that you will see movement. I think that where they're trying to be incremental and make incremental progress, and where they're running into a lot of resistance, they're saying, well, can we carve something out that we think will gain acceptance, and we'll keep working on the things that, you know, where there's still details that need to be worked out to get people to participate.
Awesome. Any other questions from Marilee at all?
I have a question, Robbie.
Huh?
Is there any type of alignment action, or like taking it all the way home for some of these patients with TEFCA and their qualifications, that, you know, we know that they need the internet at home to have EHR and have these remote monitoring programs that are coming out, and to kind of connect all the dots so those patients will have the access to care with the care coordination, as you put it, into telehealth and these other forms of care that would be utilized with this funding that we're getting through these different programs.
I think that one of the concerns, I mean, not directly as part of what the Care Equality is doing. However, we are certainly concerned. If you look at patient requests, for example, we do have an equity concern there because the bar has been raised very high in terms of what these app vendors have to do to validate the patient identity. And there's a cost factor to that, right? So are we creating a model where we're making the hospitals and health systems happy, but we're limiting the number of patients who can take advantage of the technology because, there isn't a solution available for folks, who don't have access to the internet or can't afford to pay the app fee every month. So we actually even talked about forming a specific work group for that equity conversation. I'm glad you mentioned it because I'm going to bring that up and find out where we landed on that.
Yeah, because that's a concern with some of the clients that I work with is, we know that the patients qualify for these programs, but we just need to take it all the way home for them and send a care coordinator sometimes, or even a nurse to that house to make sure that they have the tech in their house, and then we can execute a telehealth visit, or if we're doing remote monitoring, that remote monitoring visit.
Yeah, and I'm hoping that the new emergence of this care coordination, opening that up will also help, where the direct patient access might not work, that care coordinator can help drive it, Doug, just like you pointed out. All great points. And I think there's some other great comments in the chat on this also.
Excellent. And I would just mention too, that all of the billions of dollars going into the middle mile project to expand broadband access in the state as well. Hopefully can help with that, Doug, too. Well, excellent. I know we're a couple minutes over, but Marilee and Jim, I think Jim, you may be on the phone. Thank you so much for providing these updates today. And I think it's super helpful. I think one thing for this group to think about is, or consider is just how the DXF and CDII really has been mentioning and requesting that, organizations that are able to do so leverage national frameworks like Care Equality. So I think it'll be super exciting and important to continue to follow all of the advancements through the advisory committee, and especially kind of think about how this work can be translated into the DXF. So, Marilee, super appreciate your time today and all this great content.
We love sharing the hard work happening over there, for sure.
Thank you.
Thank you.
Timmy, should we just share a couple updates before we sign off?
Yeah, I know we're way past time here, folks, but just, real quick, we can go back and just make sure that you've got these on your calendar. We're out and about, especially with the DSA education work that we're doing. So make sure you have these on your calendar, and I'll just highlight next week we will be in Burbank with a great panel on CalAIM and data exchange. And then also I'm really looking forward to, and I think it's here, the APG work. Maybe it's not. Well, we need to add APG and then also the town hall at
We've got the town halls here on the 23rd for folks that are interested in going to State of Reform. This will be the first town hall that will be at a State of Reform conference, and it'll be focused on interoperability. So we're super excited to be collaborating with State of Reform on that session, and really encourage folks to join us in Sacramento on the 23rd of May.
And let us know if you're there too, so that we can do some type of a meetup in person. And then also just some really great reports that have come out that we're following. You probably saw these in our roundup as well. I don't know, Robbie, if you want to give any highlights.
Sure. I think I would point out the second one, this white paper from NICE that came out around, exchanging data between health and social services sectors. I think lots of good tidbits that really similar to what we've heard here at these meetings and workshops on the topic in the context of 1115 waivers. And this last one too, this had a lot of buzz on Twitter and on health news websites around patient preferences to be able to get your lab results in the patient portal before your provider approves them. We're working to get some of those folks who worked on this study and who are in the patient advocacy world to come and join us in the coming month to share more about this work, and I think to implications for policy, especially as we see states pass laws requiring, a certain wait period before results are published in patient portals. So more to come on that study as well, on that topic.
All right, well, call to action. If you can go ahead, grab your logos, get your signatures in, and then also send to partners. And we'll get back to you and keep you
I
posted.
sent mine right back to Angie. Is that okay?
Yeah, Angie's fine. We'll
Okay.
forward anything we get. Send it to me. We'll make sure it goes where it needs to go. Thank you, everyone. Have a great day. Bye-bye.
Thanks, Timmy, Robbie, everyone else.
Bye, Doug. Bye, everyone.
Bye.